Right. There is a question from so many of our attendees. Dr. Dinesh has also put the same, that there is a long list of lubricants available in the market. So, in
Yes.
your clinical practice, how do you choose a lubricant, sir?
I think we should spend few minutes here. I think this is the most confusing subject, and there are too many products, and our market space is very crowded. So how do we decide? uh, for deciding the lubricants, you need to take into account what kind of patient you are dealing with, meaning what is the etiological diagnosis. Number two, whether the dry eye, in your opinion, is mild, moderate, or severe. Number three, does what is the affordability of the patient? Can he afford? These tier supplements are very expensive. If patient who is a folding type and has a severe dry eye, you want a molecule which can stay longer, which is preservative free, and ocular residence time is more. So I would go more for those molecules like what do you call sodium hyaluronate, or other molecules which are in that type. CMCs are mostly, if you are using the lubricants less than 4 times, for some reason you are not able to avoid the CMCs, then you should avoid them.
Your voice is not coming.
And
We cannot hear you, sir.
okay, let me check my
Yeah, now,
audio.
now this is
I
fine.
think
Now this is fine.
maybe I moved little back.
Yeah, it is
Uh,
fine. We can hear you, sir.
okay. So what I was saying is, those patients who have severe disease, you need to pay attention about the ocular resident time, the preservative free, important points. But if they can't afford, again, even if you prescribe, they won't buy. The patient on whom you are giving, say for example, a computer specialist, computer vision syndrome, I don't think there is very big rationale to give them a very expensive or these kind of medicines, because they really have symptoms for because of the functioning style, not because of the surface related issue. Another element I decide is, when I find staining positive, that means whatever the tear film status is affecting the epithelia, and I would like to use more a molecule which will stay longer and which will be preservative free. I hope that answers, but it is a very
Yeah.
difficult and complex problem. I realize that.
Right, sir.